I'm honored to introduce Ann Lewandowski, who several in the room know who she is and what she does. She'll describe that herself, though, background, and then where things stand on several different topics. So, Ann, without further ado, you're already mic'd up?
So thank you so much. You probably know me from the case Johnson & Johnson, or Lewandowski versus Johnson & Johnson. You may have heard that case was dismissed last week, and that is all I will be able to say about that. I have my master's in legal studies in health law and compliance, and I do not provide legal advice. And I do not have any conflicts of interest where there's money flowing from any of these cases or any vendors that we have. So this week, today, we're going to look at a federal update in 2025, what's happened with the Big Beautiful Bill, what's happening with PBMs, mental health parity, and anticipated regulation. We'll also talk about some state updates. And you're probably sitting here thinking, why do I care, Ann? I'm an ERISA plan. I have preemption. Well, we'll get into that. And we'll also talk about three pieces of litigation. And I've thrown in a brief talk, actually, a more than brief talk on importation on Chris's request. So, one big, beautiful bill. This is sort of the signature and active legislation that came through before the spending resolution earlier this last month. And so there were a couple of changes that you want to pay attention to, and that's that your participants in a high deductible health plan can now use their direct primary care, and they can also pair that still with an HSA. So they can pay through the subscription through an HSA, and if you are engaging in that, they're no longer disallowed from having a high deductible health plan. Telehealth still came back. The provisions are there. You can continue to provide that with your HSA dollars. And there is this reintroduction of a catastrophic plan into the ACA marketplace. A couple of things about that. The first is there are restrictions. First is an age restriction, under 30. So if you have employees under 30 who may be interested in having less generous coverage, cheaper premiums, they may be looking at this, or if you're doing an ICHRA, that would be a potential for them. If you're over 30, there are 19 exemptions that allow you to opt into this plan. One of them is medical debt. And we know that 41% of people carry medical debt, so it's very possible many people would opt into a catastrophic plan, which if you already have medical debt, a very high deductible, limited paying upfront may actually aggravate that problem rather than make it better. So mental health parity, the big headline is the rule that was sort of promulgated in 2024, started to be implemented earlier this year, was challenged in court by ARIC, the ERISA Industry Committee, and the rulemaking was actually polled in 2025 in May 2025. So that sort of onerous rule, there's somebody who was talking about Congress getting involved and creating more challenges and regulations. That rule was pulled. However, the law remains, and the requirement to have an NQT analysis is still there. So if the Department of Labor asked you for that, you would need to produce it. So some of the clients I've worked with this year have been working on those NQT analyses. PBMs, we're here to talk about PBMs. There's been a lot of action on the Hill, a lot of hearings, many bills introduced. What we're probably looking at, if it passes, because there's really only 2 more weeks between now and the end of session, when they go on Christmas break and then they have to come back and bills need to be reintroduced, is a potential for a smaller PBM bill that only needs to pass a single committee. Right now, they're very large bills that would need to weave their way through several committees, and then as you get into the meat grinder of Washington, it gets very complicated with a lot of horse trading. One thing that you do want to pay attention if PBM reform is important to you, and it should be important to all of us, is that there is the potential for this reform to only cover Medicare Part D, as in dog. And what I'm hearing from the consultants is that if Part D as in dog reform passes, you may lose the appetite to continue that reform. So just be mindful that if there is a bill introduced and it starts moving, you may need to work with Chris and Sean to get your voices up and lifted, that perhaps including a fiduciary duty requirement in that PBM bill would be a good thing, as we've heard today. A couple other regulations that are potentially flowing or being introduced: access to your data. I know many of you may continue to struggle with access to your data. Rachel talked about that earlier today. What data, when, how, why? We're hearing that there's strong interest to introduce new legislation further clarifying and giving you rights to that data. And then also this idea of disclosures. So the Consolidated Appropriations Act required that you receive disclosures from your brokers and service providers. This is a very general term. The House Ways and Means Committee sent a letter defining that really they mean everybody in this food chain. So we talked about the auditors and consultants upon consultants and GPOs and everybody in the supply chain. So that may come, and it will depend a little bit on how EPSA resolves a case that's outstanding, which is Weiderholden versus Assured Partners. Okay, now I'm going to kick the bear a little bit. I know that we have some manufacturers in here, and I also know that we have some importers. So let's talk about personal importation as a pathway to cheaper drugs. Section 801D 1B of the Food, Drug, and Cosmetic Act specifically says that for the purposes of the guidance, the manufacturer of the new drug application, NDA, or biologics license application, BLA, is the holder of the importation group. So if you are talking with somebody about importation or international sourcing, as they like to say, ask them what citation they have for that permission. So Section 804 of the Food and Drug and Cosmetic Act does actually allow a state importation pathway. That state importation pathway has to be approved by the FDA, has to be able to prove it's safe, and that it will lower cost. Now, you have probably been hearing something about MFN. That's most favored nations for our non-drug people in the world. And really what that is doing is the Trump administration is comparing our drug costs, as you heard on the video, 400% above average industrial countries, to a benchmark of other industrialized countries and trying to negotiate and lower that cost. So you've probably seen a lot in the news about GLP-1s and those costs really coming down. That is one of the examples of MFN pricing. Why does she reference a gray area in the law? Well, the Medicare Modernization Act actually did allow for the importation of drugs from Canada. And there are many, many exclusions. They include biologics, refrigerated products. These are really your physician-administered drugs. These are your high-cost drugs that are driving your spend. And I would say really examine that. I would also say there is a case, it's Gilead versus Meridian Health, where a patient received drug that was potentially supposedly from Canada. It was actually through Canada. It was an HIV drug. The patient reached out to Gilead and said, why am I getting a drug from Turkey? And this led to a whole Lanham Act case with deceptive marketing challenges. So what they are doing there is Gilead is actually suing Meridian, and a few other people have been added to the case under the Copyright Act, saying that they are infringing on that copyright. So this is the civil way to enforce that law. And there has been speculation that there will be a Lanham to DOJ prosecution pipeline where these Lanham Act cases happen, and the facts of those cases become simple facts because they're tried in a court of law, and then it becomes much easier for the DOJ to prosecute if they choose. And then there is the Coalition for Safe Medicines. They have done a video on this. I tend to disagree that the case is fully settled. They tend to think that this is defined law, but they are actually sending out and saying, reach out to us if you're receiving these imported drugs. So, state update. I'm gonna rush through this because I'm running a little short on time. So, prescription drug affordability boards, these are a very popular topic. There's about 20 of them. And what they do is they set an upper price limit. They had not done a very good job, but Colorado actually created the first upper price limit for Enbrel. So it's saying that health plans cannot reimburse above this price. Now, that sounds great as a plan sponsor, but ERISA preemption may cut two ways. And there may be a challenge that you would be not held to that upper payment limit, is what it's called, because of ERISA preemption. So there's also privacy laws and AI healthcare bills. These interact. So with healthcare bills, those relate to a topic in ERISA. That means that it's likely preempted. However, generally applicable privacy laws that include things like you have an ability to opt out of automated decision making. What does that sound like? That sounds like AI to me. Well, if that is passed, there is the potential that you as plan sponsors need to consider how that would happen with your vendors and the people within your plan. And PBM laws continue to proliferate. However, there have been several exemptions, PCMA versus Mulready and McKee Foods Corporation versus BFD, that challenge the application of any willing pharmacy. So that does not actually apply to you in ERISA. So let's get into Tiara Yachts versus Blue Cross Blue Shield. Anybody heard of this case? A few of you. Okay. So at issue, Tiara Yachts sued Blue Cross Blue Shield for using flip logic. And I wrote this down because I want to get it absolutely perfect. So flip logic reimbursed out-of-network rates at higher rates than those negotiated by the regional Blue Cross Blue Shield affiliates known as host blues. So under the Blue Cross Blue Shield network, each individual state blue hosts a network of groups and providers. So when your employees go to an in-network blue plan here in Texas, they have the host blue network rate. When they perhaps traveled to Florida, that Florida blue was supposed to honor that rate. So the host blue should have a network provider that perhaps the Texas blue does not, and it should honor that lower rate. Well, what they allege here, Tiara Yachts, is that instead of paying at that network blue rate, they intentionally paid non-network rates or their own rate at full prices, and then engaged in a shared savings program. Anybody have a shared savings program where perhaps they're intending, so pay attention. So they flipped these claims and said, oops, we paid too high. We're going to lower the physician reimbursement. And by doing that, we're going to collect, I believe it's a 30%, don't quote me on that, but between 20 and 30% shared savings incentive. So Tiara Yachts did this for a couple of years and then realized maybe this is one of those things that we've been talking about all day, that really perverse incentive. So what they said is, hey, Blue Cross Blue Shield, you're a fiduciary. You're exercising discretion over plan assets. We pay you. We have this activity. And that this perverse incentive, this flip logic where they are perhaps a party to that transaction, might actually be a prohibited transaction. So initially, Blue Cross Blue Shield, or Tiara Yachts lost, and then they had to go on appeal to the Sixth Circuit. And the Sixth Circuit actually sided with Tiara Yachts and said this has to go back down to the district court for further remediation. Well, now Blue Cross Blue Shield has filed their own complaint and said that Tiara Yachts is in fact a co-fiduciary. They knew of this shared savings program, so it can't possibly be a prohibited transaction. And when they terminated the contract, they engaged in a statute of limitations and contractual agreement that, in fact, they had fulfilled all of their duties and there would be no litigation. So the status is these two are going back and forth. Since it's yachts, if anyone watches Below Deck, I sort of think of this as like the really messy couple that are really trying to figure it out. And we will watch this very closely because if in fact we do see that these plan payments are plan assets, we may not need to go to Congress to say you have a fiduciary duty, that in fact it is implemented by the courts through their interpretation of the law. And I would also say, for those of you who may be skeptical of the DOL, rightly so, the DOL actually filed an amicus brief on behalf of Tiara Yachts when they went on appeal. And essentially they said, if you do not, Sixth Circuit, if you do not hold Blue Cross Blue Shield accountable, you will essentially get fiduciary provisions under the ERISA law. So it was actually a very good, well-worded amicus brief. So it is important to remember that sometimes the DOL is occasionally on your side. So let's talk about International Union of Operating Engineers Local 49. This is GLP-1s. This is actually a very interesting case. So at issue, there's an obesity carve-out in the summary plan document. And the obesity carve-out says we can only pay for a very cheap generic to treat obesity. We don't do any bariatric surgeries or anything like that. So somehow, Optum started paying for GLP-1s for weight loss. And so they actually missed a couple of reports and accrued $3 million in expenses on these GLP-1s for the weight loss drug. So Optum alleges that they received verbal permission from International Operating Unions 49 on the issue of paying for the GLP-1s. But of course, you have to know your summary plan document is your Bible on what you can pay for. And I ran this by a lawyer and he said, because there's also this issue of opting into a PBM program without checking your plan document and making sure that those are consistent. And so I ran this by Jonathan Levitt. He's a good friend of mine. And it says in his very strongly worded email for an attorney is a PBM might pay for a GLP-1 even when it's carved out of a summary plan document, but doing so is truly unlawful. So this will be very interesting to watch as well. So I'm going to wrap up with multi-district litigation. Multi-district litigation requires plan sponsors to file their own lawsuit. There's two. We heard about this issue of rebating with insulin products that drove up the cost substantially. This lawsuit seeks to hold the manufacturers and PBMs who did that accountable because it alleges that they colluded to increase prices for purchasers because there's only 3 that manufacture insulin. So there are per employee per day damages, it's insulin. There are some early GLP-1s for their diabetes indication only. And the bellwether cases were intended to be tried in 2025, but they've actually been pushed due to court challenges into 2026. But there is a court deadline. And if you're interested in filing, you have to file by the end of this month, actually. In MDL 2724, this is a Sherman Act violation that the generic drug manufacturers came together to divide up the market and drive up the price. And if you read the complaints, they're actually quite fascinating and very troubling, that they actually came together as manufacturers and said, hey, I'm going to take this drug. Nobody else is going to manufacture it. Or, hey, we all manufacture this one very cheap generic. Let's raise our prices in lockstep. And anybody who did not play well in the sandbox, in quotes, because that is what they said and referred to, you basically got blackballed from the industry. So that's definitely a challenge. So with that, moving into the midterms, things are going to be slow in Washington. So don't wait for Washington to pass PBM reform. Really review compliance when you're looking at importation vendors. I'm not here to give you legal advice. It would say talk with an ERISA attorney, but also talk with a Lanham Act attorney. And, ERISA trumps many, many state laws, but there are some broadly applicable laws you may want to pay attention to. And the good news is many of those come through the National Association of State Legislators, so the template language is pretty similar. So it should make compliance a little bit easier, hopefully. Of course, each state does do their own thing. And then there are multiple cases to watch in the courts, including multi-district lawsuits. Thank you.
Any questions for Ann? Hold on.
Is there a concern that employers will be actually roped into actually being a defendant? Because really who it hurt were the patients.
I think that's a great question. So to be very clear, the defendants in the insulin multi-district lawsuit are only the big 3 PBMs because they make up 80% of the market share. And the allegation is that they were able to extract rebates from the 3 manufacturers, and this created an organization for collusion. So it's really Express Scripts, Optum, and Caremark that are the defendants there.
You mentioned a Tierra Yachts case, and I want to make a point here, Ann. I commend the work that you've done on Johnson & Johnson, and we all appreciate you. On the Tierra Yachts case, what I always like to suggest as well is the allegations that are in these lawsuits are open for all of us to read.
Yep.
It's all available. And some of us that actually participate in these fiduciary lawsuits, we're under non-disclosure and aren't able to talk about the details that we get to see.
Yep.
But the allegations that are in those lawsuits are very important for each and every one of us, especially in the Tierra Yachts case that we can talk about because that is out in the open. And that's a situation where it went on for almost a decade, where there was a system glitch that took place across the United States of America for every blue plan that was out there, with an exception of the automobile industry. And in that case, it will show you how systematically overpayments were continuing to happen knowingly, and continued to happen, and then the revenue stream that occurred after that. And that's the hence of the big case there. We knew about it, we're making revenue out of it, let the system continue. So very important to take the gold nuggets that are in these cases, I would say, is probably what you would recommend as well, right, Ann?
That's really great. I would also say, if you have the time, which nobody really has the time, but if you can, if you're ever interested and you look at these lawsuits, look at the exhibits, because the exhibits are really where the nuggets of gold are. It's where perhaps text messages alluding collusion fall, where meetings of competitors come, and also where emails may appear, and that's my time, saying, we knew about this. So thank you.
Well,
I think
actually,
that's a great
we're going to go a couple minutes longer because we started a few minutes late. I have a question, though.
Okay.
The CAA certainly puts the label on the plan sponsor as the fiduciary, but the idea of employees suing their employer, I mean, that's not a good message you want to give to employers, and certainly to our benefits directors here. What do you see more likely going forward? Employers suing their plan for breach of fiduciary responsibility, or employees in class actions going against their employer? Because I think it's probably a combination of both, but with transparency here comes great responsibility, and the idea of saying I didn't know is no longer going to be a valid argument. But that threat of the fiduciary lawsuit is not probably the best tactic that we should be thinking.
So one of the things that I learned in law school, even though I'm not a lawyer, and this is friendly advice, not legal advice, I didn't know is never a defense. The courts will never believe you, and they will not care that you didn't know. So that's the first thing. The fiduciary lawsuits are not going well. Like I said at the beginning of my presentation, my case was dismissed last week. So I would say the concern there is not that you are going to be sued right now. I think that people are sitting out watching and waiting. But I do think as you are a human and thinking about your own family and looking at these service providers and their conflicts of interest and really the money they're making, right? And this is where this Consolidated Appropriations Act disclosures become so important in pushing on them. Hey, you're not getting a per claim fee. Are you getting any overrides? How is this working? Those become so important because you're also acting in your own interest, right? At some point, all of us are a patient. We will need to use those benefits. And if your employees are overpaying for a prescription or overpaying in a network rate when they go to the doctor and that copay is calculated and they have to pay higher amounts in order to go to an out-of-state doctor, that may be you someday. Yeah. And I think that that's the most important message.
Thank you so much, Ann. Yeah, go.